Welcome! In this explainer, we're diving into the essential tools that keep you as a personal support worker and your clients safe. We're going to break down the key skills that are absolutely crucial when you're out there providing care. So, let's get right into it.
So I want to kick things off with a question for you. As a professional caregiver, what do you think your everyday superpower is? Is it your compassion, your strength, maybe your incredible patience? Those are all vital, for sure. But there's one that really holds everything else up.
And that superpower is this: keeping you and your clients safe. Now, this isn't just about following a bunch of rules. Think of it as a professional skill. It's the very foundation that lets you give the best possible care with total confidence.
To help you master this, let's imagine we're building your own professional toolbox. Today, we're going to stock it with 5 key tools. We'll start with mastering infection control, then we'll jump into meds and food safety. After that, we'll cover the really crucial skills of observing skin and mind, and then what to do when incidents happen. And finally, we'll see how it all pulls together to create your professional impact.
Okay, let's grab that first and, honestly, most critical tool for your toolbox: infection control. The big idea here is something we call routine practices. It just means we treat every single interaction as if germs could be present, even if someone seems perfectly fine. Your job is to be a germ stopper.
And the heart of that process is the Point of Care Risk Assessment, or PCRA. This is your stop and think moment. Seriously, before every single task, you just pause for a second. You ask yourself, is anyone showing signs of being sick? Are there any hazards around me, like clutter? The answers you come up with will guide everything you do next.
Infection control really stands on 4 main pillars. First, that PCRA we just talked about, stop and think. Second, hand hygiene. This is your #1 absolute best weapon against infection. Third is using PPE, personal protective equipment, but only when your PCRA tells you it's needed. And fourth, controlling the environment. Just create a small, clean, safe zone for your work. If you can remember those 4 things, you're already an infection control pro.
Okay, time to add the next tools to our toolbox: med and food safety. And the key concept here, the big one, is understanding your scope of practice. That means knowing exactly what you are allowed to do and what you absolutely cannot do. This isn't just a random rule. It's a critical professional line that protects both you and your client.
And this slide lays that boundary out perfectly. Over on the left, that's what you can do. Give a verbal reminder, hand over a dosette that's already been filled by a professional, and then watch and report what happens. But look at the right side. This is the must-not-do list. You never, ever pour pills from a bottle. You never fill or change a dosette, and you absolutely never get to decide if a client should take their medicine. If something seems off, anything at all, your job is to report it right away.
So, here's the bottom line. Your role is cueing and prompting, not administering. That one little sentence says it all. You're there to help the process along. You're not the one in charge of giving the medication.
Now let's talk food safety, which is just as important. And it really just boils down to 4 simple rules. Clean, wash your hands, wash the surfaces. Separate, keep raw meat far away from everything else. Cook, make sure food is cooked all the way through and that leftovers are reheated until they're steaming hot. And chill, get those perishable foods in the fridge fast. And please always remember the golden rule of food safety. When in doubt, throw it out. Okay, moving on from physical tasks to awareness. Our next tool is one of your most powerful, and that's observation. As a PSW, you're often the very first person to notice the little changes before they turn into big problems. You are quite literally the eyes and ears of the entire care team. When it comes to skin, you're looking for some very specific red flags while you're doing your routine care. Things like redness that doesn't fade when you press on it, any blisters or open areas, swelling or new pain. And you want to pay extra close attention to those high-risk spots like heels, hips, and the tailbone. The rule here is simple. If you see any of these red flag changes, you report them the same day.
Now, safety isn't just physical. If a client starts talking about wanting to die or feeling hopeless, you have to take it seriously. Let's talk about the highest level of concern, which is called imminent risk. This is when a person has a specific plan, they have the means to do it, and they intend to do it. In a situation like this, your next step is absolutely clear.
And that action is to call 911. Right away. If you believe the risk is imminent, there is zero hesitation. You call for emergency help. And if it's safe for you, you stay with the client.
So what about other levels of risk? Like if someone has concerning thoughts but no immediate plan?
Your job is not to be a counselor. It's not to diagnose. Your professional role is to recognize that there is a risk and to escalate it immediately to your care manager or the on-call clinician. You are that vital link that gets them connected to the help they need fast.
This brings us to the final tool in our professional toolbox, knowing exactly what to do when an incident happens. Having a clear, calm procedure is everything when it comes to managing the unexpected, whether it's a safety issue or even a workplace injury.
And the steps are really direct and logical. First and foremost, make sure everyone is safe. If it's an emergency, you call 911. Then, as soon as you possibly can, you let your care manager know what's happened. You have to report any physical injury or serious risk, and then finally, you'll document the facts of what occurred. Following these steps just ensures a professional and effective response every time.
So, we filled up our toolbox with all these essential skills. Now let's just pull it all together and talk for a second about your professional impact.
Because at the end of the day, your mastery of these tools is what defines you as a safe, effective, and truly professional caregiver. It's not just about the tasks you do. It's about the professional judgment you bring to your work every single day. That's what builds trust and ensures the highest quality of care.
So I'll leave you with this question to think about. Looking at this toolbox we've built together today, how will you consciously pick up and use just one of these tools to build even greater trust with your client tomorrow? Because that right there is the real-world impact of your professionalism.